Hi and a very good day to all of you. I am Danial Firdaus, a student from Faculty of Language and Communication, taking Bachelor in Public Relations with Contemporary Media. Today, I want to share to you an insight about Public Relations Department impact on the Malaysian Ministry of Health. Every organization needs a public relations department to help create and maintain the company's positive reputation and image, as well as to ensure effective stakeholder communication. The management and delivery of healthcare services in Malaysia are under the control of the Ministry of Health, a governmental body. The nature and core of the Malaysian Ministry of Health organization is in charge of regulating the nation's healthcare industry. Its main goals include ensuring that all Malaysians have access to high-quality healthcare services, promoting healthy lifestyle, disease prevention and control, and making sure that healthcare services are easily accessible, reasonably priced, and of a high standard. The new government has appointed Dr. Zaliha binti Mustafa as the new Minister of Health. A group of Deputy Minister, Directors General and other officials who are oversee the ministry, various departments and agencies also provide support to the Ministry of Health. Now, I will tell you a basic background about the Ministry of Health. Malaysian Ministry of Health is the government organization in charge of developing the national healthcare policies and carrying them out. It was founded in 1951, not long after Malaysia gained independence from British colonial rule, and has since undergone a number of changes to meet the population evolving healthcare needs. The MH primary objective is to help someone attain and maintain a certain level of health in order to further enable them to lead a productive lifestyle both economically and socially. This could be achieved by introducing or offering promotional and preventive approach in addition to effective treatment and rehabilitation services, with a focus on the underprivileged group to ensure access to quality healthcare services for all Malaysians, and it oversees a network of public hospitals, clinics and health centres across the country. The MOH vision is to lead the nation in promoting health, preventing illness and providing excellent healthcare that is accessible, equitable and affordable for all Malaysians. Its mission is to lead and work in partnership with the nation towards achieving optimal health for all Malaysians through provision of quality health services, promotion of healthy lifestyle and disease prevention and control. The MOH has been helpful in managing the COVID-19 pandemic-related outbreak in Malaysia. It has put in place a number of strategies to stop the virus spread, excluding extensive testing, contact tracing and quarantine measures. The ministry has also worked with specialists and international organizations to develop and put into action fixing the crisis. Every organization has its own stakeholder. Same goes to the Ministry of Health. There are two stakeholders in Ministry of Health. One is primary and the other one is the secondary stakeholder. To be precise about the stakeholders in Malaysian Ministry of Health, primary stakeholders are the individuals or groups that are directly gain the benefits or are impacted by the MOH policies, services and other initiatives. This includes the patient, healthcare providers, healthcare workers and healthcare organizations. Most primary stakeholders have a very good interest in the MOH operation, and it is directly affected by its judgment, decision and actions. Meanwhile, the secondary stakeholders mean the individual or group that not gain direct benefits from the MOH operations, and they are not directly impacted by the decision or action that are made by the MOH. This includes government agency, regulatory bodies, the media, suppliers and community organizations. Although secondary stakeholders might not be independent on the MOH for healthcare service, they might be interested in the MOH policies and operation. The Malaysian Ministry of Health use both traditional and digital media to communicate with its stakeholders. The goal of the MOH communication strategy is to keep its stakeholders informed about the most recent healthcare initiative, updates and policies. Among the media, the MOH use are divided to traditional media, digital media and owned media. Firstly, the traditional media. The MOH communicates with its stakeholders through traditional media like television, radio and newspaper. For example, the MOH frequently makes appearance on radio and television talk show to discuss healthcare-related topics and respond to audience questions. Secondly, the digital media. The digital media is very relevant today because it can spread the information faster. The MOH is very active on social media sites like Facebook, Twitter, and Instagram. The MOH make use of this platform to help spread data on healthcare initiative, policies, and events. Thirdly, the own media. The MOH also produces its own publication, including as magazines, yearly reports, and newsletter. The policies and programs and accomplishment of an MOH are covered in depth in this publication. Typically, the MOH stakeholders, including as healthcare professional, patient, and neighborhood association, receive distribution of its own media. The Ministry of Health of Malaysia conduct several activities and events to engage with its stakeholders. Recent activities that happen has helped the community a lot. One of the activities are health awareness campaign. In educating the public about various health issues, the MOH frequently start health awareness campaign. This campaign may concentrate on particular subject like infectious disease, maternal and child health, or mental health. To plan these campaigns, the MOH frequently works with healthcare providers, networks, neighborhood association, and other stakeholders. Secondly, MOH also make the conference, seminars, and forum for its primary and secondary stakeholders in order to bring together healthcare professionals, researchers, policymakers, and other stakeholders to discuss issues related to healthcare. The MOH organize conference and seminars. This gathering gives participants the chance to communicate, share information, and work together on healthcare initiatives. Public forums on a range of healthcare topics such as mental health, vaccination, and non-communicable disease have been organized by the MOH. This gathering gives the general public a chance to interact with the healthcare professionals and decision makers while learning about the most recent healthcare regulations. Now, I will tell you about the importance of public relations in the MOH. For organizations, especially governmental entities, public relations are a crucial role since it aids in establishing and maintaining a favorable reputation, image, and relationship with stakeholders. The Malaysian Ministry of Health is aware of the value of PR in reaching out to its members, particularly during the COVID-19 pandemic. The main roles of PR in the MOH are to provide accurate data and information to the public. The Malaysian Ministry of Health employs a variety of communication platforms such as social media, press release, and media briefings to distribute information about health-related topics. The PR division makes sure that the information is timely, accurate, and gets to the public through the best means. Now, I will tell you how to engage with the stakeholders. Although the Malaysian Ministry of Health PR division is well established, there is always room for improvement. Some ideas to enhance the relationship with important stakeholders is focusing on transparency and accountability. The Malaysian Ministry of Health can increase stakeholders' engagement by emphasizing accountability and transparency in its communication. This could involve delivering regular updates on important health issues, swiftly dealing with complaints and other stakeholders' feedback, and proactively asking for input from stakeholders. MOH concentrate on fostering closer ties with healthcare professionals who play a crucial role in the provision of public healthcare service. This can be accomplished by holding regular discussion and consultation with medical professionals, giving them accurate and current information, and asking them for feedback on MOH policy and programs. In conclusion, the Malaysian Ministry of Health is an important government agency that actively promotes and safeguards the well-being of nation citizens. By giving the public accurate and timely information, handling crisis communication, and cultivating and maintaining relationship with stakeholders, the PR department of the Malaysian Ministry of Health plays a crucial role in helping the organisation fulfill its mission. The PR department really helps the MOH a lot and gives them a big impact, especially during the COVID-19 pandemic.